Before we move on, I want to quickly share something that could really help you. You can now join our online NCLEX crash course, specially designed to help you pass the NCLEX on your very first try. This program has already helped over 1 lakh nursing students clear the exam successfully. And now, it's your turn. And here's the exciting part. We're giving a limited time 70% discount on the course fee. But remember, this offer is only for a short period, and seats are filling up fast, so don't wait too long. To enroll, just download our mobile app. You'll find the link in the description box below, or you can scan the QR code you see on your screen. This NCLEX crash course is truly a one-stop solution. It's a proven shortcut that helps you study smart and pass with confidence. So don't wait. Enroll now and stay ahead of thousands of other students in the race to pass the NCLEX. And yes, if you'd like some free PDF notes for NCLEX questions and a free NCLEX ebook, just download the mobile app. You'll get instant access to all those materials right away. All right, let's get back to learning. Here comes the next question. Hello, future nursing champions, and welcome once again to your daily dose of high-yield learning with Stan Coast Coaching. Every day, we explore 2 to 3 powerful NCLEX topics that transform complex medical concepts into simple, unforgettable lessons. And today's topic is one that beautifully connects the body's defense and drainage systems. Our focus for today is nursing care of clients with inflammatory and obstructive lymphatic disorders. Conditions that may seem rare, but hold immense clinical importance. We're going to dive deep into disorders such as lymphangitis, lymphadenitis, and lymphedema, exploring how inflammation, infection, or obstruction of lymphatic vessels can lead to swelling, pain, and functional impairment. In this session, you'll learn how the lymphatic system maintains fluid balance, what happens when this delicate network gets blocked or inflamed, and, most importantly, what nursing interventions prevent complications like chronic edema, infection, or fibrosis. We'll also highlight vital patient education points, including skin protection, limb elevation, exercise therapy, and infection prevention, all essential for exam success and safe clinical practice. I need to share something urgent with you. If you are serious about passing the NCLEX on your very next attempt, you cannot afford to miss the ultimate NCLEX crash course. More than 100,000 students have already cleared their exam with it. And you can too. Why is this course different? Because it gives you everything in one place. Live interactive classes, recorded lectures you can rewatch anytime, 5,000 practice-style questions, 30 practice tests, ebooks and PDF revision notes, a student planner, and detailed NGN question explanations. This is your shortcut to success. Don't wait, scan the QR code or click the link in the description now. You will instantly unlock free study content including NCLEX quizzes, PDF notes, and practice tests, plus access to our Telegram and WhatsApp groups with even more support. Moving ahead into another vital clinical scenario, let us discuss a question that highlights the importance of surgical history in nursing assessments. A 78-year-old client is newly admitted to a long-term care facility with noticeable lymphedema of the right upper extremity. Upon reviewing the medical record, the nurse must determine which past condition most significantly contributed to this finding. The options include the client has a healed fracture of the right humerus, the client underwent a radical mastectomy several years ago, the client is currently receiving treatment for pernicious anemia, and the client received smallpox immunization during childhood. The correct answer is option 2, the client underwent a radical mastectomy several years ago. To understand this, let us explore the expanded advanced rationale. Lymphedema is a chronic and often irreversible condition, characterized by the accumulation of protein-rich lymphatic fluid in the interstitial tissues, leading to swelling, fibrosis, and impaired immune response. The most common cause of secondary lymphedema in the upper extremity is the removal or destruction of axillary lymph nodes during a radical mastectomy. In this surgical procedure, not only are the breast tissues and underlying muscles removed, but also the axillary lymph nodes responsible for lymphatic drainage from the arm. This interruption in lymphatic flow results in stagnation of fluid within the arm, causing persistent swelling distal to the node removal site. Over time, the chronic stasis leads to tissue thickening, decreased elasticity, recurrent infections such as cellulitis or lymphangitis, and potential loss of limb function. While complete reversal is unlikely, nursing interventions such as limb elevation, compression therapy, manual lymph drainage, and range of motion exercises help promote lymph return and maintain function. In contrast, A healed fracture of the humerus, as seen in option 1, might cause temporary edema during the acute recovery phase, but does not damage the lymphatic system permanently. Option 3, pernicious anemia, is an autoimmune condition leading to intrinsic factor deficiency and vitamin B12 malabsorption, causing megaloblastic anemia and neurological deficits. But it does not impact lymphatic drainage. Option 4, childhood smallpox vaccination, has no correlation to lymphedema and does not cause chronic lymphatic obstruction. From a nursing care perspective, patients with a history of radical mastectomy must receive lifelong education about preventing complications. Nurses should instruct the client to avoid venipunctures, injections, or blood pressure. Monitoring on the affected arm, maintain meticulous skin hygiene, wear compression sleeves during exertion or air travel, and report any swelling promptly. Preventive measures are crucial to avoid fibrosis and functional loss in the affected limb. Now, transitioning to our Stan Coast clinical insight, remember this powerful nursing truth. Every drop of lymph has a destination. When its pathway is removed, it finds nowhere to go. In post-mastectomy clients, swelling is not just cosmetic. It is a lifelong circulatory imbalance demanding vigilant nursing care. And moving on to the Stan Coast high-yield NCLEX Pearl, keep this point in mind. After a radical mastectomy, axillary lymph node removal disrupts lymph drainage from the arm, leading to chronic lymphedema. Therefore, teaching clients to protect the affected limb from trauma, infection, and constriction remains the cornerstone of long-term management and a key NCLEX-tested nursing responsibility. Before we move on, I want to quickly share something that could really help you. You can now join our online NCLEX crash course, specially designed to help you pass the NCLEX on your very first try. This program has already helped over 1 lakh nursing students clear the exam successfully. And now, it's your turn. And here's the exciting part. We're giving a limited time 70% discount on the course fee. But remember, this offer is only for a short period, and seats are filling up fast, so don't wait too long. To enroll, just download our mobile app. You'll find the link in the description box below, or you can scan the QR code you see on your screen. This NCLEX crash course is truly a one-stop solution. It's a proven shortcut that helps you study smart and pass with confidence. So don't wait. Enroll now and stay ahead of thousands of other students in the race to pass the NCLEX. And yes, if you'd like some free PDF notes for NCLEX questions and a free NCLEX ebook, just download the mobile app. You'll get instant access to all those materials right away. All right, let's get back to learning. Here comes the next question. Let us now transition into a critical clinical scenario that tests your understanding of post-mastectomy care and lymphatic management. A 62-year-old woman who underwent a right radical mastectomy 6 months ago reports increasing heaviness and swelling of her right arm. Upon examination, the nurse notes visible pitting edema and tightness of the overlying skin. The question asks, when planning care for this client, which nursing intervention is essential to include in the care plan? The options are as follows. Option A suggests avoiding giving injections in the right arm. Option B recommends avoiding turning the client on the right side. Option C advises avoiding active exercise of the right arm. Option D indicates avoiding trimming the fingernails on the right hand. The correct answer is Option A, avoid giving injections in the right arm. Moving deeper into the reasoning, this question highlights the pathophysiology of post-mastectomy lymphedema, which occurs when axillary lymph nodes are removed or damaged, interrupting lymphatic drainage from the affected arm. Once the lymphatic channels are compromised, even a minor trauma, such as an injection, venipuncture, or blood pressure measurement, can trigger irreversible swelling, tissue fibrosis, and infection, including cellulitis or lymphangitis. This is why nurses must strictly avoid any invasive or compressive procedures on the affected limb. Instead, nursing care focuses on measures that enhance lymphatic flow, such as elevating the arm above heart level, performing gentle range of motion exercises, and applying prescribed compression garments. In contrast, turning the client on the right side does not significantly affect lymph drainage unless pressure is maintained for extended periods. Gentle active exercises are actually beneficial because they promote collateral lymphatic circulation and maintain flexibility. Nail trimming, if done with careful hygiene and avoidance of cuts, is encouraged to reduce infection risk. Now shifting toward a professional reflection, Stan Coast. Clinical insight. Lymphedema care is not about restriction. It is about protection. The nurse's vigilance in avoiding trauma, injections, and venipunctures to the affected limb serves as the most effective lifelong defense against chronic swelling and infection. And building upon that wisdom, Stan Coast High Yield NCLEX Pearl. After a mastectomy, never use the affected arm for blood pressure measurements, intravenous infusions, or injections. Always teach clients to elevate the limb above the heart while resting. Perform gentle daily range of motion exercises, wear compression sleeves during daytime hours, and maintain meticulous skin and nail hygiene to prevent infection. NCLEX Key Point: protecting the affected limb from trauma, infection, and constriction forms the cornerstone of post-mastectomy nursing care.